Hi everyone, welcome to today's video where we will explore something called a SOAP note. This is obviously an acronym, and for those of you new to healthcare, this field is full of acronyms. A SOAP note is the standard format that healthcare providers use when documenting the patient's encounter for healthcare services. So let's break this down just a bit further. The S in SOAP stands for subjective. This is the part of the patient's encounter where the patient describes their symptoms to the healthcare provider. They often explain the history of their present illness along with any other acute or chronic problems. So, this subjective area is also called the history of present illness, or the HPI. As an example, let's say the patient has made an appointment to see the healthcare provider for lower abdominal pain, a low grade fever, and urinary frequency. All of that information provided by the patient is usually documented in the subjective part of the SOAP note, or the history of present illness. Basically, the healthcare provider has been given a set of symptoms explaining the reason that the patient has came in to be seen. The patient has a history of urinary tract infections, and the healthcare provider has made sure to include that information in the documentation. The second part of the SOAP note is the objective part. This is where the provider starts gathering the information, such as the physical exam, and possibly further medical tests. So, back to the patient who has come in to be seen for lower abdominal pain, a low grade fever, and urinary frequency, the provider might order a urinalysis and or lab work. So in this case, the urinalysis came back with 3 plus bacteria in the sample that was provided by the patient, and the patient's oral temperature is 100.3 degrees Fahrenheit. The third part of the SOAP note is the assessment. This part of the process involves the provider's hypothesis of what the problem is. So, this step requires that the provider combines the patient's symptoms with the examination or test results to determine the next part of the note, which is the plan. This is the part of the process of how the provider plans to address the problem, usually with a final diagnosis followed by a treatment plan, or if the results of the subjective and the objective information do not point to a definitive diagnosis, the provider might refer the patient to see a specialist who can further help with a diagnosis. So, going back to the example above regarding the patient with a lower abdominal pain, a low grade fever, and the urinary frequency, the provider has determined that along with a positive result of bacteria found in the urinalysis, along with a low grade fever, that the patient has an acute urinary tract infection. The provider prescribes a course of 100 milligrams of macrobid to be taken twice a day for the next 7 days. The patient was instructed to take all of the pills even when they start to feel better, drink plenty of fluids, and rest when needed. Now that you have a better understanding of what a SOAP note is, you might still wonder why you needed to learn this. A medical coder can abstract ICD-10 or diagnosis codes from different parts of the SOAP note depending on what type of codes are assigned. As an example, we learned from the subjective part of the note, or also known as the history of present illness or the HPI, that the patient has a history of urinary tract infections, which is ICD-10 code Z87.440. Many Z codes can be captured from different parts of the note. However, the principal or the primary diagnosis must be assigned from the assessment and plan section. So we learned from this example that the final diagnosis is an acute urinary tract infection, which is ICD-10 code N39.0. There are a couple of more codes that could be captured from this example for the urinalysis and the evaluation and management CPT code, but for the purposes of this example, we're going to just focus on the diagnosis codes. So for this particular encounter, the ICD-10 codes that would be assigned are N39.0, which is the primary diagnosis for the UTI that was found under the assessment and plan, and then Z87.440, the history of their past urinary tract infections, which we found in the subjective part, are also known as the history of present illness. So we are going to stop at this point and we're going to look at how to apply CPT codes to a patient encounter in the next video. The main goal of this post is to explain what a SOAP note is and how we find diagnosis codes from the provider's documentation. Another key guideline of assigning medical codes is that we only code what is documented by the provider. As medical coders, we do not interpret test results. We are not clinicians. Our job as a medical coder is to provide the correct codes based on the provider's documentation. So I mentioned in a previous video that our job as a medical coder is akin to being a translator. We are translating a large number of words into just a few letters and numbers. That's it. It is vitally important that we understand medical terminology and also that we have a thorough understanding of anatomy and physiology. And it also helps to have a basic knowledge of prescription drugs. However, remember, we are not clinical staff. We work within the scope of someone who understands the documentation provided by the clinical staff, such as physicians, nurse practitioners, and physician assistants. But we, as medical coders, do not assign codes based on what we think the diagnosis should be. Okay, so we have learned how a medical coder assigns codes, and in this particular case, diagnosis codes, or also ICD-10 codes, based on the provider's documentation. We've learned what a SOAP note is and why we need to understand the process. So please stay tuned for the next video as we will dive a little deeper into assigning CPT codes and even some HCPCS codes as well. So if you have any questions, please feel free to leave a comment below and I will get back to you as soon as possible. Thanks so much for joining me today, and until I see you again, have a great rest of your week. Oh, and before I forget, take a look at some of the items that I have picked out at Amazon that I feel like medical coders probably would get the most use of some of these items. I get a very small commission if you were to purchase any of these, but just to let you know, they're there, so check it out in the comment section. All right, I'm done. Thank you so much again. I hope to see you again, and have a great rest of your week.